Words of advice for people who have had DBS and they don't feel like it's been as effective as they want it to be, or does that kind of cover most of your suggestions?
I mean, the easiest one, not that I recommend this to everybody, is if you don't feel like it works, turn it off. You have your remote, turn it off, wait, see how you feel. If you're like, oh my gosh, I feel terrible, or my tremor starts going out of control, it's obviously doing something for you. I mean, it seems like a cheap answer, but the reality of it is that happens. Now, I will put another asterisk by that answer is you get a carryover effect in some people, meaning I can shut off the DBS and that person may look perfect, the exact same they did on DBS for 10 minutes, for 5 minutes, for 5 hours. And then all of a sudden their true nature of the disease comes back. They talk about this lesioning effect or this honeymoon effect that you get post-surgery, where all of a sudden your symptoms are magically better even though the DBS isn't actually on. And it's just that aspect of putting something in your brain in that area of your body reacts that way. Well, to a similar manner, it's that way when you turn it off. Your body, psychologically it thinks, oh, well, it's still there, when in fact it may not be. And then all of a sudden it realizes, oh, we don't have the juice that we need, and now you start seeing your symptoms. So you got to play with that a little bit. And really it's looking at it in a long-term way as, okay, how was I before surgery? Okay, I was popping Rotari or Cinemet 6 times a day, and I was having off-cycling every 2 hours, and I still didn't have good tremor control, and I couldn't think clearly, or I had lack of focus, versus now, okay, I am still taking 6 times a day of Rotari or Cinemet or an agonist, but now I can go 4 hours without an off-cycling moment. It's not perfect by any means, but that's a pretty significant improvement from 2 hours to 4 hours. So it's a relative thing. You got to give a certain perspective of progress. We use this all the time in physical therapy. People say, "Oh, I'm not getting better." And it's like, well, what are you measuring? You got to look at what you're measuring, and there probably are gains that you may not even be aware of.